Alright guys, so for IM injections, you give intramuscular injections, really in 4 sites. You can give it in the deltoid, as well as the dorsal gluteal, which is the bottom, the butt, the dorsal ventral, which is really just like the hip right here, and also the vastus lateralis, which is just your thigh. So usually your book will say that no more than 1 to 2 mLs in the shoulder, and anywhere in the leg, books say nothing more than 2.5 mLs, but you can probably put in a 4 ml in someone's leg. It really just depends on the size of your patient. So guys, let's see here. I'm going to show you how to draw up real quick a medication out of a saline vial here. Thanks for the video. Alright. So let's do it. So we have, say the doctor orders, let's say 1 milligram in Ativan, okay? So, so let's say Geodon, or let's say 2.5 milligrams of Rocephin, and it's in our vial here. So we look at the concentration of the vial. Let's say we have 2.5 milligrams in 5 mLs. How much would you draw up? How would you do your medication calculation in your brain? Well, we know that in 5 mLs, we have, let's say we have 5 mLs, we have 5 milligrams of Rocephin. We only want 2.5, right? So we're going to draw up 2.5 here in our syringe of air, push it in our vial, boom, push the air in, bring our blunt end syringe down, and bring it back, okay? Now, some nursing instructors will get on your A if you touch the inside of the syringe here, because they're saying it's not sterile, so just use the end of the plunger, okay? So you're pulling up 2.5 mLs, okay? And check your vial here. So you pull that up. Now you label your freaking drug, okay? Get the air out, label your drug, make sure that if you drop this on the floor, they know what drug it is, okay? So you take off your blunt syringe, and you attach your appropriate insertion catheter with it, okay? So, if you're giving it in the arm or the leg, you're probably going to get a 23 gauge syringe here. That's usually the most common. It's 1 inch to 1.5 inches, just depending on the person's size. If you're going to do it in the butt, I do 1.5 inches. If you're going to give heparin, or if you're going to give, let's say, insulin, 25 inch syringe is good, but usually they have insulin syringes like this that measure the units of insulin, okay? And insulin is given subcutaneously, not intramuscularly. So let's say it's a pretty viscous, very thick Rocephin we're going to give. We're going to do a 21 gauge. That is a large bore needle, okay? So you're going to draw it up. Make sure that the bubbles come out the top here. That was a lot. I kind of wasted a little bit of mine. But you want to make sure you bead your drug here. If you can see that on the end. You're beading your drug, okay? So you make your landmark. You swab with your alcohol prep from in to out. If you use a Z-track method, you're putting the Z-track, pulling the skin taut, holding this like a dart, okay? Aiming, sticking it in like a dart, grabbing right here, pulling the plunger back. That's called aspirate, because we want to make sure we're not in a blood vessel. And we push it in, okay? Push it all the way through. And you're pushing that into your patient. Now, I don't want to get it all over the ground. but I'm pushing this into my patient, okay? So, it's just mechanics, guys. It's really mechanics. I say grab an orange, practice that, guys. Practice with an orange. I used to do it all the time. At least 10 times before clinicals. Grab an orange, Z-track method. Dart, boom, flow, and push. Do it again 10 times. Dart method. Z-track, tot, punk, pull, and push. Do it again. Dart method. Z-track. Push, pull. Because you do not want to get in clinical like this, and the patient's looking at you, and your instructor's looking at you, and you're pulling, and you push, and then you just push, right? No, you want to be smooth. Boom, boom, boom. Grab, pull, push. So if you do it 10 times before you actually do the dang thing, then you're going to be very, very smooth as you're in clinical rotations. Now, they say that your dexterity on your best practice day will only be about 60% during the live demo. So they tell cops a lot that you're only going to shoot 60% accurate on your best day in training because of all your nerves and all of your adrenaline rushing. So 60% of your best day, you guys want to make sure you're good at it, like really good. And just go out there and it'll be just muscle memory. Boom, 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 aspirate, bam, and you're done. So that's really IM injections in a nutshell.